For joining us for this RJR Gleaner Group virtual town hall meeting. I'm Dion Jackson-Milo, and welcome to our listeners and viewers on all our platforms: TVJ, Radio Jamaica, Power 106, JNN, OneSpotMedia.com, TVJ's YouTube channel, and the Gleaner Online. Now, people have been asking, what's a virtual town hall? Well, it's this. It's a town hall in the time of COVID. You stay at home in the safety of your own home and you participate virtually via Twitter, Facebook, Instagram, WhatsApp, text, and Skype. We want you to send in your questions, including video questions, and we'll be putting them to our guests throughout the program. Now, in studio with me, we have the Health Minister, Dr.Christopher Tufton. Also with us, the Chief Medical Officer, Dr. Jacqueline Bissesa-McKenzie's Association, Dr. Elon Thompson. Now, I want to jump right into your questions. And in this first segment of the program, we want to talk about the restrictions that have been imposed. And some of those restrictions, in fact, take place tomorrow. So let's start off with some of the questions that you've been sending in. And we have a question from a listener, a viewer, who wants to know about the issue of bars. Why is it that the restrictions have been announced and that bars have had to close while other entities have been told that they can remain open with fewer than 20 people? Now, who wants to start off with that? Dr. Tufton, Dr. Bissesa-McKenzie, want to close down the people in bars. Why couldn't bar owners or bartenders be told you can stay open but have no more than 20 people?
The specific entities that would be required to close was based on a risk assessment of not just clubs, amusement type of facilities. Their margins are very in that, of course. I'm sure, there are bars where that kind of interaction wouldn't allow for that, because one of the things the government did not want to do is to close the facilities that provide basic sustenance for the population. There are some Jamaicans who have to depend on daily earnings in order to go for their daily shopping. And to shut down those entities over a 5 to 7 day period could be a difficulty. And so it really was weighing all of that in the balance.
Well, if we follow that rationale, why are churches not closed? So?
Well, churches
because I heard the strong urging,
right?
But we didn't hear close them in the way the bars were told you have to close.
So churches would have to conform to the 20 or less regulation, and yes, one could decide to apply churches as one of those to be closed, but without appearing to discriminate, because I do visit bars and churches. Let me state that up front. Without appearing to discriminate between the two, I would like to say that we believe that the church, given certain instructions, would probably conform more to those instructions, given the size of churches on average. They're larger than bars, and the type of interaction.
Well,
I know it's a difficult one, but there's a distinction that we felt was qualitative enough to allow limited numbers in the church.
Let me ask Prof to jump in.
Yes, thanks for having me on the program, and good night to all our listeners. I'd first like to commend the minister and the team at the ministry and the government for the proactive way in which they have moved to try and slow the spread of this virus that causes COVID-19. When it comes to the question of bars and churches, wherever people are gathered, we run the risk of persons passing the virus from one to another. So the importance of reducing people interacting in crowds really must be emphasized. Now, the one advantage that churches do have over bars is that the churches can play a very important social role to help to look after those who are at risk, the elderly, because most young people, children, young adults, even if they become infected with the virus, they'll get sick, but they are most likely going to recover fully. There are very few deaths among children and adults, young adults. It's the elderly. So the churches have to think about how to help ensure that the elderly stay in, but they are supported to get what they need.
But they don't need Sunday and Sabbath service to do that.
I think they can do online services. They can send out bulletins. There's church on TV and radio. But it's good for them to organize how to help the elderly in the communities and to get the young people doing it more than the elders helping the elders.
Okay. Doctor, we seem to be, how would you describe our strategy? Because you have what is called mitigation, where the aim is to reduce the spread, which the UK was trying and hoping that herd immunity, a lot of people would develop immunity, as opposed to suppression, which is what China was doing, just shut down everything and try to stop the epidemic. And we've seen the UK switching now and ramping up its measures. We seem to be somewhere in between. We're closing some places, we kind of seem to be relying a lot on voluntariness. So how do you describe what we're doing?
So right now, you're going to see a combination of strategies. I mean, we started out with delaying, and that was where our focus was. So our 4 main objectives are to delay, to contain, to manage, and then to respond, and then to recover rather, and to recover better than we were before. So initially, you would have only seen us looking about the delay part of it and the preparing for in the meantime, because that's the point of the delay. To prepare, not just to prepare us locally, but to prepare globally, because we want to give time for vaccines to come about and to be developed, and for antiviral treatment to develop. We want those things to take place, as well as to prepare our own health response in terms of what it is that we do when we get cases.
So we are somewhere in between mitigation and suppression.
Well, right now, we are doing containment, so we are between delay and containment. Mitigation is reducing the impact of what is going to happen. And yes, we are doing mitigating activities in just by our delaying and preparing for what is happening. In terms of suppression, that's where containment comes in. So we want to contain what is happening, to suppress it, to prevent the spread of the disease.
Camila is asking, let me put this to you, Dr. Thompson, can we hear more about preparedness of frontline workers? Most updates seem to be phrased in the future tense. I'm seeing a lot of doctors expressing uncertainty about the preparedness of hospitals and workers.
So, good evening to you and the listeners. It's a difficult situation, and the feeling of the physicians is going to reflect what the general population is feeling. What I will say, though, is we are trying our best to get the information to the physicians as quickly as we can get it. Over the last few days, I can tell you we've been getting a lot of information and transferring it on.
Do they feel?
You see, the perception, though, is a different thing. And the perception is based on the reality that we see every day.
What's the perception?
So the perception is that we are lacking in certain areas.
Is that perception or reality?
For KPH, it's a bit of perception. It's a difficult situation for the mass fitting, because I understand that there's a challenge with staffing, the persons who are able to do the mass fitting. So there's a challenge with the number, the capacity to do the actual mass fitting. So we are trying to see how best we can address that, because that's a problem, that's a challenge. So a lot of the frontline workers who are at KPH, for instance, they need to be mass fitted. But we're trying to work through that with the Ministry of Health and try and get as many persons on the front line mass fitted. It's developing, and these discussions are ongoing. We just have to try and be level-headed and try and be, astute about all the realistic problems that we have and put them forward.
Okay, another question about the healthcare workers. Judith asked, in light of the view that taxi operators are refusing to transport the nurses, shouldn't a shuttle service be provided for them? And I know you did announce at the press conference earlier that 5 buses have been acquired. How extensive that is, because again, that sounds like a Kingston-only thing.
Right. So it is not adequate. It's a good start, but not adequate. And that came, by the way, was in train for some time. What we have done is ask the hospital management to look at the arrangements that are currently in place and where there are gaps, to put arrangements in place to support the nurses being transported, not necessarily to their homes, but to central points that would allow them to get appropriate transportation to their homes. In addition to that, however, I think it's important for us to emphasize to the taxi drivers, to the public transport system, about this discrimination that surfaced some time ago. I don't think it's widespread in terms of a sort of mass situation, but the president of the Nurse Association, when I spoke to her, did tell me that there were occurrences in about 7 or 8 parishes. And so we try to address that perception that nurses are somehow contaminated, because that's not the case, but also indicated that it's really against the law for them to do that. And hopefully that will help, but we will put some measures in place also to give support.
Okay, let me ask you though about tomorrow, because new restrictions come into place tomorrow and people seem very confused. How it work? What's an essential worker? What's a non-essential worker? Who determines whether I work from home or not? And will I get in trouble if I don't? So how it works? I think that's you, Doctor.
Well, there is a distinction between the public and the private sector. In the public sector space, the measure required the permanent secretaries and the heads of agencies to work out an arrangement with the staff that would be governed on the principle of working from work where you cannot avoid it and working from home where that opportunity exists. So it's really discouraging persons coming to work but not abandoning work. In the private space, as you know, we have specified some private entities. Others, what we have articulated the same principle, but generally speaking, governed by the 20 or less rule. So what we're really trying to discourage is congregating of mass numbers, because, as was said earlier, it would increase the chances of spread of the virus.
A question here, Bell's Laundry Logan. Why don't spas in hotels close? Spa treatments aren't essential now. Therapists are putting themselves at risk by doing massage. The Minister of Tourism should tell the hotels to close all spas until that is over. Is there any stricture there? And I would add as well, does a closure for bars relate to hotel bars as well?
Well, there are restrictions around the hotels. The 2-week quarantine period where persons come into the country, we made a distinction between locals, and we made some specific principles around hotels. We did indicate, based on the guidelines, the Quarantine Act and the guidelines related to this, suggest that the quarantine would apply to persons remaining on property, persons being allowed to go to the beach, to the pool, restrictions around mass restaurants, and I suspect that would apply to bars too. I'd have to check to see exactly. But there are some guidelines that would continue to discourage, encourage social distancing, and while at the same time still allowing the possibility of tourists to enjoy some of the amenities on the hotel, at the hotels.
I tell you, Dr. Tuff, I tell you what, because there are a couple more questions I have to ask about this hotel tourism thing, because it all seems a little bit fluid, and I want a couple comments on it, but I'm just about at the break. So let me go to the break. We come back. Remember, our hashtag is TVJ Town Hall, and we have a number of platforms. We're inviting you to continue to send in your questions. Soon come.
Please visit your doctor or the nearest health center and share your travel history. The flu and coronavirus can kill. Let's protect each other. A message from the Ministry of Health and Wellness. Reduce your risk of viral illnesses like the flu and coronavirus. Wash your hands frequently with soap and water. Cover your nose and mouth when coughing with a tissue and dispose of it. Avoid close contact with anyone with a cold or flu-like symptoms. If you become ill, please visit your doctor or the nearest health center and share your travel history. The flu and coronavirus can kill. Let's protect each other. A message from the Ministry of Health and Wellness.
COVID-19 tip. Protect yourself and others from getting sick by washing your hands after coughing or sneezing, when caring for the sick, before, during, and after you prepare food, before eating, after toilet use, when hands are visibly dirty, and after handling animals or animal waste. COVID-19 tip. Protect yourself and others from getting sick by washing your hands after coughing or sneezing, when caring for the sick, before, during, and after you prepare food, before eating, after toilet use, when hands are visibly dirty, and after handling animals or animal waste. COVID-19 tip. Protect yourself and others from getting sick by washing your hands after coughing or sneezing, when caring for the sick, before, during, and after you prepare food, before eating, after toilet use, when hands are visibly dirty, and after handling animals or animal waste.
Reduce your risk of viral illnesses like the flu and coronavirus. Wash your hands frequently with soap and water. Cover your nose and mouth when coughing with a tissue and dispose of it. Avoid close contact with anyone with a cold or flu-like symptoms. If you become ill, please visit your doctor or the nearest health center and share your travel history. The flu and coronavirus can kill. Let's protect each other. A message from the Ministry of Health and Wellness.
And thank you so much for staying with us. We continue with our virtual town hall. We have questions coming in. And just to add, in fact, to all those famous people, right here in the Caribbean, the Prime Minister of St. Lucia, in fact, has been tested. He has self-quarantined. And let me just go back just to the issue of tourism that we had been talking about, Dr. Tufton, because you were explaining the restrictions that should take place. But anybody who has been into our hotels know the tourists coming for a good time. The first place they want to head to is the bar with a whole heap of people. And for you to say you're coming on vacation, stay by yourself, don't be in groups of more than 20, and it all seems highly artificial. It sounds like it's just something we're saying. When I really think it's going to happen.
Well, I'll be totally frank with you and say that it certainly is not going to be easy. And I suspect you will get some cancellations. And indeed, I think there have been some, having spoken to the Minister of Tourism. Under the circumstances, the alternative would have been for a total shutdown. And I do think that there are some holidayers who would still come and enjoy themselves because the opportunity is still there. Not everybody wants to leave the compound. Some persons come for the beach, some for the pool. And of course, they can wine and dine and enjoy themselves doing that. So it will have an impact, I have no doubt. But we wanted that option to be there for those who would like to enjoy it.
Then we go to Prof. You wanted to go back to the nurses issue, Prof?
Yes. I think it's natural that many people feel anxious about the situation because it's a mutation of a virus that causes a problem. But we have to remain calm in a situation like this. And we've been through many public health challenges in Jamaica and managed them. Going back to the parathorn poisoning in 1976, when all flour had to be withdrawn in the island. We had a massive dengue out. We've had swine flu. We had malaria in Kingston and St. Catherine. We've dealt with all of those things. Now, this is a challenging epidemic. But let us think of a nurse and a health provider. The health providers are the other group who are more at risk than most people. It's the elderly and the health providers. You think of a nurse who is going to work or leaving work. This is the same very nurse who may be looking after the taxi driver who is driving past her if he gets sick. So we need to be calm, and we can't just act on the first thing that comes into our head.
All right, I have two questions here coming in about airports. Both Debbie and Carleen asking about plans for the airport, with Carleen saying, I have to interact with passengers. I consider that mass gathering. What are the measures being put in place?
You want to take that?
Okay, well, for our workers at the airport, we have had several sensitization sessions. I must say that almost 1,000 persons have attended those sessions across the island at our ports of entry. And so we have tried to educate everybody about coronavirus and the way it is transmitted and how it is that they protect themselves. And the same kind of measures apply in terms of, first of all, keeping your distance, using hand hygiene.
Let me stop you a moment. Put that in the context of what I'm seeing when I'm seeing an immigration hall, which is a whole mass of people. So is it that we're saying to people as they're coming in, you have to stand 6 feet behind the other person in line, or not?
Well, I think that some of that is going to have to happen now.
But it's not happening now.
Well, we will have to look at how we enforce that now, because it means that we're going to have a more controlled kind of approach so that everybody's not congregating in the immigration hall. But in terms of the healthcare workers and the other workers within that entrance into the protective measures in terms of the distancing and in terms of washing their hands frequently, keeping the surfaces that are in front of them clean, sanitizing frequently. And of course, there is always that if somebody has a cough or has symptoms, for them to offer that person a mask to prevent them from spreading infection or separating, pull them out. That's why we have the temperature screeners as well, so that anybody who is detected there, they are pulled out.
I was about to make that point as an important point. Remember, there is a filtering that takes place even prior to going into the immigration area. If you take Kingston, for example, Norman Manley, when you come through that tunnel, there's actually a thermal scanner that you can't see, but is being monitored. Persons with
is that new, or it's been there all along?
No, it's been there for a while.
It's been there from 2015 when we were dealing with Ebola.
Okay.
Right.
That's when we had installed those
and it's
scanners.
Always operational?
So someone with an elevated temperature would be identified once they go through that scanner, and the nurses can pull them from the line and interrogate them, and that happens.
Okay, I want to move on now to the issue of quarantine and isolation, because we have quite a number of questions coming in on that as well that people want to know. I think, first of all, perhaps just very briefly remind people what's the difference, Doctor, quarantine as opposed to isolation?
Well, we quarantine persons who don't have symptoms. Once persons have symptoms, then they are isolated. The quarantine is really a period of observation, close observation, to see when it is that these persons develop any problems, that they can be detected early.
Okay, Julius is asking what's given to people who are in isolation for treatment.
Okay, so the treatment is symptomatic, just like influenza or a lot of the other viral illnesses. rest, fluids, hydration is very important, managing the fever. For these persons who are going to be having mostly respiratory symptoms, then there are some treatments that would be in place for those depending on what they're presenting with. If it is increased drainage from the sinuses, if it is that they're wheezing. If persons develop shortness of breath, then there are specific treatments that would be applied in those cases. And of course, all persons who would be developing, for example, pneumonias, and there is a screening to see if there are other causes of the pneumonia, and there may be other treatments that may be indicated.
Dr. Thompson, are you satisfied with the arrangements for health professionals if there are problems?
Satisfied is a strong word. It's a work in progress. We have now been invited to the EOC meetings, and we've had a few sessions.
What's EOC?
So the EOC is the Emergency Operations Center.
Okay.
So there is a briefing that is done every day, and we've been invited to that, and we've been a part of that. So I think the discussions are ongoing. We are going to have challenges on the ground. What we do have is a direct communication with the Ministry of Health where we have challenges, and hopefully they can be addressed in a speedy manner.
Nettie is asking, do we have to pay at the hospitals when we go to get tested for corona if we're hospitalized?
Well, first of all, the decision,
The short answer to that is no, because all the testing is done through the public health facilities. So all the samples will go to the National Public Health Lab and will be tested at the National Influenza Center.
Okay, Prof. Figueroa, is there a concern in terms of our level of our numbers of ICU beds? I saw a paper from UA that estimated 30 functional adult ICU beds across Jamaica, and this is a situation where if we get numbers of people going into respiratory distress and needing ICU beds, what are we going to do?
Yeah, this is definitely a concern, because as the outbreak grows in Jamaica, then we're going to get increasing numbers of people who need to be hospitalized, and some of these will need intensive care. And this is why it is so important at this stage of the epidemic to try and slow down spread as much as possible so you have fewer persons who get severely ill. The more you can slow down the spread, it means you reduce the numbers of those getting severely ill. And I'd like to just add something to the question of quarantine, because we must remember that if a person develops a cough and cold, it is more likely at this stage that the person is suffering from a common cold, or they may be suffering from influenza, or parainfluenza, or adenovirus, or other viruses that circulate at this time of year. And therefore, it's very important that persons who do have symptoms, but they are not severe, they stay at home and try and manage the situation so that they are not spreading what they have. They can contact their doctor, but really, most times they'll be quite okay. It's only if they develop severe illness, high fever, shortness of breath, or difficulty breathing, then they definitely need to contact their doctor. If they're going to a private doctor, phone him first to alert him, or phone one of the ministry numbers to alert the ministry so the health provider knows that this is someone who needs attention.
Okay.
I just want to add in terms of the critical care beds, and when I spoke about recover and recover better, this is one of the things that we want to ensure that we do, because there has been a critical shortage for many, many years in terms of the critical bed space. And what we are doing in response, the government has allocated funds, and we have on order 35 ventilators and high dependency unit beds, as well monitors, infusion pumps. We have all of this equipment that we have ordered Now, we do realize that there is going to be a period to delivery, and especially at this time where it is challenging right across the world to get equipment in. So this is very important in terms of delay and slowing down the epidemic, as Prof said, so that we are able to handle it, because we do know that our ICU beds are chronically full.
Yeah.
And so we have to look to other spaces for these persons to be placed in if we do get patients.
Now you mentioned ventilators there, because I saw somebody asking on Twitter earlier today about the number of ventilators we had. And the response from somebody else was, do we mean actual ventilators or interns sitting there bugging people pretending to be ventilators? So
we're talking actual ventilators.
Actual, okay, okay.
So that's an interesting point.
Tell me why.
Because the interns are having to bag patients now on shifts. So I would implore that the hospital administrators look into that, because that is a concern that has been brought to the JMDA.
What do you mean?
So they've been...
Explain because the first time I saw it, I was stunned. Just explain quickly for our viewers and listeners.
Let me try
what
and
that
simplify
means.
it. A patient may come in and require supportive care with their airway,
right,
and a tube is inserted into...
To help them breathe.
To help them breathe. Now, because we have no...
machines,
no any ventilators, then they will have to be manually bagged, we call it. So pressing the bag to ventilate them manually. And, you know, there are times when the interns have to do this on a shift basis. Now, you know...
Meaning the person needs assistance for so many hours.
Hours.
An intern would be doing this for several hours. The person's shift ends.
And another intern comes.
Still sitting there bagging
the patients.
Manually. Okay.
And, you know, I had a meeting at Cornwall Regional Hospital recently where this came up. So the hospital administrators not necessarily has to come to the Ministry of Health, but the hospital administrators, they have to look into this and have some kind of arrangement with the intensivists, that's the anesthesists, and, you know, the heads of departments, the various heads of departments, to try and see how best they can manage the situation, because the interns cannot be there bagging a patient indefinitely.
Especially if we have its situation. One more question before we go to break. O'Neill asking about isolation. Surely it's difficult, he asks, for people to isolate themselves, especially if they're around family. Are there special places designated, and if so, where? How do you determine when somebody goes into isolation and the whole issue of isolating yourself from your family?
Okay. As the outbreak progresses, there are going to be different ways in which we deal with isolation. At the start of the outbreak, our aim is to contain as much as possible, prevent any kind of contact. So we will definitely have to isolate persons that are suspected cases and confirmed cases in a hospital setting. However, as time goes by and more persons are going to be infected, then you will find that the direction now is going to be that persons with mild illnesses will be, they may be, whether they're seen in hospital, they may be sent home to isolate themselves at home, or as indicated before, the instruction has been to persons to, if you develop symptoms, stay at home and call. Call the hotline numbers and we will provide some direction to you as to how it is that you can manage isolating yourself. I think when persons are motivated by the fact that they do not want to infect their loved ones, who may be elderly persons who are more at risk. You may have a mild illness, but the person you infect may have comorbid conditions or may be elderly and may not suffer such an easy course with the disease. So I think the phone contact that we have with persons, that we are able to reiterate these things, have a one-on-one discussion of what your situation is and how best to perform this is quite important. And I think, you know, the persons have been taking advantage of calling, and it is available. We are accessible. We encourage persons to call.
Okay, we're going to go to the break. You're watching the RJR Gleaner Group virtual town hall meeting on COVID-19. Stay
and coronavirus. Wash your hands frequently with soap and water. Cover your nose and mouth when coughing with a tissue and dispose of it. Avoid close contact with anyone with a cold or flu-like symptoms. If you become ill, please visit your doctor or the nearest health center and share your travel history. The flu and coronavirus can kill. Let's protect each other. A message from the Ministry of Health and Wellness.
COVID-19 tip. Protect yourself and others from getting sick by washing your hands after coughing or sneezing, when caring for the sick, before, during, and after you prepare food, before eating, after toilet use, when hands are visibly dirty, and after handling animals or animal waste. COVID-19 tip. Protect yourself and others from getting sick by washing your hands after coughing or sneezing, when caring for the sick, before, during, and after you prepare food, before eating, after toilet use, when hands are visibly dirty, and after handling animals or animal waste. COVID-19.
Reduce your risk of viral illnesses like the flu and coronavirus. Wash your hands frequently with soap and water. Cover your nose and mouth when coughing with a tissue and dispose of it. Avoid close contact with anyone with a cold or flu-like symptoms. If you become ill, please visit your doctor or the nearest health center and share your travel history. The flu and coronavirus can kill. Let's protect each other. A message from the Ministry of Health. Reduce your risk of viral illnesses like the flu and coronavirus. Wash your hands frequently with soap and water. Cover your nose and mouth when coughing with a tissue and dispose of it. Avoid close contact with anyone with a cold or flu-like symptoms. If you become ill, please visit your doctor or the nearest health center and share your travel history. The flu and coronavirus can kill. Let's protect each other. A message from the Ministry of Health and Wellness.
Staying with us for this RJR Gleaner Group virtual town hall. We're in studio, you're at home. We're taking your questions via various means, social media, text, WhatsApp, and the list goes on. All right, let me go back to a kind of basic but fundamental question. Patria K wants me to ask. She says some people are still asking, what's the big deal? Worldwide, more people die from mosquito bites and even the common cold and flu. Explain to those people why COVID is getting so much effort, attention, and resources. Prof. Figueroa, let me ask you that.
Well, there's an important point here, because every year, for instance, in the United States, perhaps in the region of 400,000 people have to be hospitalized due to influenza, and they have on average 25,000 to 30,000 deaths a year, and globally at least 400,000 deaths a year due to influenza. And there is a vaccine that is available for influenza which can definitely help to protect and prevent many of those deaths. However, this is an important virus, and many persons who are elderly may become ill. We don't know sufficiently about it, so we have to respond decisively to try and mitigate the adverse impact from it. reduce any number of deaths we can. But we do need to pay more attention to influenza as well and ensure that we have full vaccination of that.
Okay. John is asking for a little bit more information on Cornwall Regional. Dr. Bisesa Mackenzie, is there currently a functioning ICU? How many critical care beds would be available for COVID patients at Cornwall, and how many ventilators are there?
Okay, so we know that because of what's happening at Cornwall, ICU activities had scaled down. I think Cornwall initially had 6 ICU beds. When the facility was moved to Falmouth, we only had 3 beds there. So those 3 beds are still functional. Presently, the facilities that we're using for isolation at the Cornwall Regional is a section of the Accident and Emergency Department that we had built actually to deal with the crowding in the Accident and Emergency Department. And that space can hold probably 1, maybe if you push it, 2 persons in full isolation, and then there's an additional area that can hold persons if we group persons together. So definitely not ideal, an ideal situation.
Sounds like a massive understatement.
Well,
sounds like if we run into trouble in Montego Bay, we'd be in trouble.
Right. But we have to remember, though, and that is true, because we would have to be looking at moving persons out if we end up with critically ill patients that we would not have enough space to accommodate there. However, when we look at the modeling that was done by the National Epidemiology Unit at the Ministry of Health and Wellness, what we saw was that in comparison and using an estimation that is coming from what happened with H1N1, we're expecting that at peak, we would be having about 11 critically ill persons. So that helped to determine how many additional beds we wanted to have. Because while we will have critically ill patients right across the year, then we want to make sure that in terms of that peak demand, that there would be facilities somewhere in the island. So we understand that there is a deficiency in not just Cornwall Regional, but by virtue of what is happening at Cornwall Regional in the entire Western region. And so therefore we are prepared that we would have to transfer patients if it is that they are facing a challenge.
All right. In a moment, I want to move on to the issue of tracing. But just before that, Tracy is asking a question I've heard over and over. What about the BPO sector? At what point will the government instruct them to close?
Well, the new arrangements does apply to them also in terms of the congregation of persons beyond a certain number.
So when you have these floors that we've heard described, how many people?
It can be quite a lot.
Right.
It can range in the
hundreds. So they are supposed to what? Send home?
So they are supposed to work from home where that can be arranged, and my understanding is that some of that is possible, and to the extent that they can create some social distancing even within a particular space, then they are supposed to take that into consideration and adjust.
Is anybody following up, though, to ensure that these kinds of restrictions are being imposed? I mean, are you going to be driving around Kingston seeing if the bars are closed, if the
Well, it starts effective tomorrow.
Yeah.
And
there's a whole heap of bar on the place.
I know. As many churches as bars, and vice versa. But this is an instrument, a legal instrument, which was gazetted today, read out by the Honourable Prime Minister, and therefore enforceable by law. And yes, it would require the constabulary to be engaged and to ensure that the law is upheld. I'm sure there are persons who may choose to not observe, but they'll do so at their own risk. It's not something that we want to use draconian measures to enforce. What we're hoping for is that the population would recognize that this is really in their best interest, and they should observe this 7-day period while the public health infrastructure tries to address the situation.
Right. So I want to move on to the issue of tracing. Now, in preparation for this, I went back through the statements, went back through the various releases, and we're trying to track what is happening with the different patients, and it was virtually impossible because you hardly give us any information. So for instance, Dr. Tufton, at a press briefing, you announced or you were asked about the hospitals which are currently housing patients, and so we got that information. We know we have them, patients at Cornwall Regional, at
Chess. Mandeville, Chess Hospital, UWI.
Right. But in terms of patient one is from this community, somebody else is from that community, so you can actually figure out what is going on. We don't have that information. Why is that?
Dion, it's a little bit difficult to put all the information out, because in terms of how we are tracking, because what you have to recognize is that when we have, for example, a person who is in St. Anne who then goes to another parish and spend time in another parish, then we follow that link and we have to trace everybody in that parish.
But if you look at patient one, for instance, so I mean, patient one, who I think started out as patient 0. So we had heard, if you look at the map, for instance, this is about the only information we have, that we had that patient one who seems to have been on a tour of Jamaica. I guess she was on vacation. So we know she was in Bull Bay, and we know she was in Goshen to visit her father, but there's almost nothing else we know. I think we heard Devon House and we heard the funeral. But in relation to the other patients, we don't have that kind of information, so people can say, hold on, our paths crossed, maybe I need to self-isolate or quarantine or whatever.
I think we have to sit down with our communication experts and determine how it is that we give the public the information to enable them to be able to act. Certainly, it's not that we're keeping secrets, but it's not that we're keeping secrets, but we don't want to put out information that is difficult to understand.
Let me give you an example.
Create more confusion.
So the first time we heard about the first patient, we had heard she came in on a flight. The ministry initially didn't tell us which flight, right? And when we were asking, we were told, it didn't matter because she was asymptomatic on the flight and it wouldn't have made any difference. 2 days later, the ministry is putting out the flight number and saying, if you were on this flight, contact the ministry. But what is that?
Well, let me explain that. There was a lot of persons that were concerned. We would not normally contact trace this particular flight because the person was not symptomatic at the time. But this was new in the country, and we recognized that persons were concerned and they wanted clarification. So they called in. Several persons called in, and we were able to reassure them. But this would not have been, in terms of contact tracing, we wouldn't have gone to that flight. So all the persons that have been contacted on that flight, we have been able to reassure them, and they feel better having had the conversation with us. So we recognize that it was an important part of calming the public and reassuring the public to make this announcement. And it has helped with regards to those 2 flights.
All right. Well, I'd love a comment from Prof on this. As I mentioned, we know which hospitals people are being treated at. I don't know if that is information we need to have, but we know that. Other information, as I've been saying, we don't have. What should we know? What should we be asking for from the ministry?
Yeah, this is not a straightforward question in my view. Contact tracing is an established procedure that we do in public health. And we do it for a range of different diseases. But it's not something that you do in public. There are times when the information that you give the public can facilitate, and it allows persons who may have been at a particular site or at a place where there may have been exposure to contact us. But most of the time, it works more effectively if our people can move quickly to reach those who may have been exposed. I'll give you an example. Yes. I'll give you an example. If we go back to the taxi driver and the nurse,
yes,
or the individuals in Bull Bay who said that some neighbors are crossing the road and walking on the other side of the road because they hear that that person was at the funeral.
In fact, we had information, sorry, Prof, to suggest that in one instance, persons were being threatened. And there was threats of burning down the house and that sort of thing. So there is an element to it that requires some levels of confidentiality because of the potential negative consequences.
But I think I think the fundamental issue here is that the population needs to be responsible, and they need to be responsible enough in the way they receive information. And I think that's a concern that is coming out here, how persons receive information. So when I heard about the issue with the nurses who, the taxi operators didn't want to pick them up, I was livid. The population needs to understand that some of the concerns that we have is how they receive the information. I went to clinic, a man who has COPD from smoking. He coughed because this is what COPD patients do at times. And trust me, everybody there was just going off on him. And the poor man had to, pretty much the nurse had to take him and say, okay, come over to this side, right? So I think we are responding to, these things in a way that nobody here anticipated that we would respond this way, but we have some responsibility as well to kind of mitigate some of that response.
And if I could just add to what Elon is saying, the majority of people act responsibly, right? The majority. But all it takes is a couple people in a particular area, either to threaten or to stigmatize or discriminate, and it upsets the whole thing.
But are we striking the right balance there?
Exactly. We have to get the right balance.
Are we at the right balance? Because I know a lot of people feel that we're not. They feel we're not getting enough information.
Well, Dion, we have contacted hundreds of persons, and out of those hundreds of persons, we have been able to say who are the real contacts that we should be concerned about. And those persons we are following up closely. Now, all the communities that are involved know themselves because the public health workers are there. They're literally going house to house, following up on these persons. In addition to that, we have persons, town criers that are going out, that are telling persons that they need to stay home. We are providing information to persons in various forms. So persons do know what communities are involved. Now, we are going to have the very, very casual contacts, who may think that they should be treated in the same way as the persons that are the close contacts. And that is going to that is going to create some, difference of opinion. But really and truly, we need to start at the center and move out. And as our investigations lead us in directions, then we take that direction. So it is really difficult to provide all information to the public, as we go along. The public will eventually hear, but right now our information is critical to determine what it is that we do and how it is that we proceed in our investigations. That is what is critical now.
Carrie is asking a question that I think has its roots in the confusion a lot of people are now feeling because of the patient numbering. So Carrie says patient 0 is now patient 1. Based on the announcement, the U.S. Embassy employee seems to be patient 3, who is patient 2. So everybody's drowning in these patient numbers. Who is who and who has been identified as what? But what's your response to Carrie?
Well, all I did yesterday was clarify 0 versus 1. And then everybody else, based on diagnosis, would be 2, 3 onwards. But the media had started to say patient 0, referring to the first person. But I was told by the clinicians that rightfully it ought to be patient 1. And because we were confusing because of a release that went out with patient 1 and persons were asking questions, we felt it was necessary to clarify that. So,
okay, so forget patient 0.
Yeah, forget patient 0.
Patient 1 is the lady who came in from the UK.
Right.
And went to the funeral and everywhere else. Patient 2, isn't patient 2 the US employee? No? Because Carrie is saying, who was
Yes.
patient 2?
Yes.
It would be the US
she
employee.
is, she
It would be
is.
the US.
Yes, that's patient 2.
Okay. All right. And asking as well more about the cruise ship employee. And I think this is one of the concerns as well in terms of the tracing, because you're hearing the date someone presented to the public health system, and sometimes you don't know how long were they out there spreading symptoms.
Well, that's part of the
That's part of the
investigation.
challenge, you know, that we have to face, because I mean we have to track back to when the symptoms started and see where it is that the patient has been, and you know the detailed conversation with the patient gives us some indication, but it doesn't give us all. So it's only when we go and speak to persons and get into the community then we are led to other places. So, you know, it is...
Well, following up with Carrie's question, because she's saying if the person came in on February 25th but reported on March 10, would that mean COVID has essentially been here since February 25?
If they came in with the virus, I would imagine so. Whether or not the virus manifested itself in terms of being symptomatic,
the person being symptomatic,
then clearly it would, because they would not normally go to the doctor if they presented themselves unless they had a particular feeling. So it's clear that the virus did not become symptomatic until later on. But they would have brought it in.
Hold that thought. I know Prof wants to jump in, but we're at the break. So we're going to go to break. Want to remind you, look at the screen. These are the numbers and the ways in which you can send in your questions. So keep them coming in and stay with us. We'll be back right after this.
Reduce your risk of viral illnesses like the flu and coronavirus. Wash your hands frequently with soap and water. Cover your nose and mouth when coughing with a tissue and dispose of it. Avoid close contact with anyone with a cold or flu-like symptoms. If you become ill, please visit your doctor or the nearest health center and share your travel history. The flu and coronavirus can kill. Let's protect each other. A message from the Ministry of Health and Wellness. Reduce your risk of viral illnesses like the flu and coronavirus. Wash your hands frequently with soap and water. Cover your nose and mouth when coughing with a tissue and dispose of it. Avoid close contact with anyone with a cold or flu-like symptoms. If you become ill, please visit your doctor or the nearest health center and share your travel history. The flu and coronavirus can kill. Let's protect each other. A message from the Ministry of Health and Wellness.
Tip: protect yourself and others from getting sick by washing your hands after coughing or sneezing, when caring for the sick, before, during, and after you prepare food, before eating, after toilet use, when hands are visibly dirty, and after handling animals or animal waste. COVID-19 tip: protect yourself and others from getting sick by washing your hands after coughing or sneezing, when caring for the sick, before, during, and after you prepare food, before eating, after toilet use, when hands are visibly dirty, and after handling animals or animal waste. COVID-19 tip: protect yourself and others from getting sick by washing your hands after coughing or sneezing, when caring for the sick, before, during, and after you prepare food, before eating, after toilet use, when hands are visibly dirty, and after handling animals or animal waste.
COVID. Reduce your risk of viral illnesses like the flu and coronavirus. Wash your hands frequently with soap and water. Cover your nose and mouth when coughing with a tissue and dispose of it. Avoid close contact with anyone with the cold or flu-like symptoms. If you become ill, please visit your doctor or the nearest health center and share your travel history. The flu and coronavirus can kill. Let's protect each other. A message from the Ministry of Health and Wellness. Reduce your risk of viral illnesses like the flu and coronavirus. Wash your hands frequently with soap and water. Cover your nose and mouth when coughing with a tissue and dispose of it. Avoid close contact.
Thank you so much for staying with us for our virtual town hall meeting. Every time I hear that story about the Chinese doctor who first alerted the world to COVID-19 and later died of it, that's just, I think, one of the saddest parts of this whole story. Let me bring in Prof. Figueroa. We're talking about symptoms of COVID-19 and some of the issues surrounding them. And Prof, you wanted to add something to the question about Carrie, from Carrie, about the cruise ship employee, came in on the 25th, reported on the 10th, and whether or not COVID has been circulating here, she's saying.
Yes, I'm impressed by her question. And the important point to recognize is that the incubation period, the period between a person is exposed to someone and gets infected, and the development of symptoms is anywhere from 2 to 14 days. So in the instance of this person, we have to hope that they had a longer incubation period, closer to the 14 days, and then maybe they had minor symptoms for 2 or 3 days and then came to our attention.
So during the period when they were having minor symptoms, though?
Well, initially, yes, for a couple days,
right.
Just for a couple days.
So
but if they had a long incubation period, then the virus was in them, but they weren't yet hopefully spreading it. It's only when they produce symptoms that usually you begin to spread.
Okay.
So very interesting for, to note that many of the cases that we're seeing are not just COVID negative, but they're influenza positive. So we are still in the flu season. And so, persons may be saying, but they're symptomatic, that's why we isolated them, so what's happening? But we're getting a lot of influenza positive patients.
These are contacts.
Contacts.
Okay. Speaking of influenza, Shorty is asking, what about over-the-counter medications if I have flu-like symptoms at home? Are there any do's and don'ts here?
Well, we maintain that many persons can be treated at home. Mild symptoms, and the mild symptoms are fever. They may have cold symptoms. It's important to note, though, that we are still stressing paracetamol or acetaminophen to treat the fever. There have been 1 or 2 studies that have been coming out that are suggesting that we should not use the non-steroidal anti-inflammatory drugs, just as the same instruction that we gave for dengue. So same Panadol or the other Cetamol, the other brands of paracetamol and acetaminophen.
So what's the point now? Well, let me go to the question by DJ Whistle and then follow up on that. DJ Whistle, is there a finite number of COVID-19 tests available to Jamaicans? If so, how many? What's the situation in terms of tests and testing?
Well, the initial kit that we got from PAHO had 96 tests. So we have now gotten more kits from PAHO that they have indicated to us are able to do over 2,000 tests. So in terms of the response from PAHO WHO, that has been tremendous. and they are keeping an eye on the situation and are responding to us and to our needs. In addition to that, we are also being supported by the CDC, who are also looking to provide us with additional kits.
What's the point at which you test, though? Because the World Health Organization has said to countries, test, test, test. So are we testing?
Well, we are still testing those persons that meet the case definition of a suspected case. So if you have symptoms and you are coming from somewhere that there is community or local transmission, or if it is that you've had contact with a confirmed case here, then we are testing you because you would have met the case definition, so we'll test you.
Prof, how do you, give me a little idea how you make that kind of determination, though, because how do we really know then what percentage of the population has this disease?
Yes, this is a challenge. So at the early stages of the outbreak, it is reasonable to test those who you suspect. But now we are getting so many countries that are affected and have community spread. It would be useful if we could actually identify some areas where we could do a little more testing to assess whether we can identify whether it's in certain communities or not.
So that would be like what, the Bull Bay area, for instance,
we have,
where we know there's exposure?
In addition to our suspected cases, we have now implemented a policy where all our severe acute respiratory infections that are admitted to hospitals we are testing. So whether or not there is any kind of link to a country or link to a confirmed case, we have instituted that so that we can get a feel as to what is happening.
It sounds like Prof is saying we should be doing a little bit more, though, ideally.
Right. Well, it's step by step. I'm very pleased to hear that we're now in a position to test all those who are severe respiratory infections, because these are the persons who you're most concerned about and who you really want to know if they have COVID or not. Because you see, with COVID, you can have symptoms maybe for 7 days that are not too bad, but around 7 or so days you have to be very alert, because some people then deteriorate quickly and need much more aggressive supportive care. And yes, it would be good in my view, once we can get the capacity going, to do just a little more testing in certain areas.
All right.
So I just want to add as well that in addition to that, we are testing our healthcare providers who would have fever and respiratory symptoms, just because we know that healthcare providers are at a high risk in terms of their management of the cases in hospitals. So we are having a low index in terms of testing healthcare workers as well.
All right. We want to go to Facebook for some questions from listeners and viewers there. So let us bring up some of those questions so we can put them to our panelists. All right. While we're waiting for them to go on, to come up rather. Okay. So can any animals or insects carry the virus?
Yeah, well, remember, that there is a view that bats carry the coronavirus and have been responsible probably for certain SARS, which is related, but a different mutation. Camels carry the coronavirus that causes MERS. So, and we do feel that in China, it did come from an animal to humans. But I don't think that we in Jamaica, that is our risk. Our risk is really from human to human spread primarily, and that is primarily from persons who actually have symptoms. There may be the case when someone with minor symptoms and possibly even asymptomatic may spread. But the main thing is people with symptoms. And the studies in China show that in the early part of the epidemic, maybe one case was responsible for 3 or 4 additional cases. When they took the social distancing decisive measures, they got it right down to less than maybe even one case just responsible for a third of the next case. In other words, they got it to under one case responsible for less than one more case.
Which is why, if I may come in here on the back of the clinical assessment, the measures that we have introduced are so important. The restriction of gatherings, because all the studies that I have certainly seen and the advice I've gotten from the clinicians suggests that it's going to be the most effective way to control. And which is why we try to give as much information as possible. I know you challenge us on some of the information that we give, but the truth is we really try hard to make the information available and to be accessible, because we want the public to understand, because unless they buy into what we're doing, it's just not going to work. They must understand and appreciate the importance of doing what we're suggesting for their own benefit and for the benefit of the country.
Let me see if I can take another question or two before the break. So let's go back for another question from a member of the public here. Okay. One question that I've been getting is whether or not people can be reinfected. So let me ask that first before we go to our question on screen. Can people be reinfected?
I think the likelihood is very low initially. Certainly after you've been infected and you recover, then you're unlikely to get a reinfection. We don't know how long the protection will last. And you really have to, the practice has been, if someone is admitted to hospital or you know they're infected, you want to get 2 negative tests before you release them back into the normal life.
All right. Shelley-Ann also asking, what effects could COVID-19 have on a person with autoimmune disease?
Well, I think any persons who has any chronic disease at this time need to be careful. And it is important that persons ensure that they're taking their medications and that they do other things to keep their immunity up. Eating healthily, exercising, resting, make sure that they're well hydrated. All of those things will help. But I mean, we are now just seeing COVID in our population, and we are yet to see what is the response in certain groups. Fortunately, all the cases that we have seen so far have been mild cases. And I think we've had 2 persons who have had chronic illnesses, and 2 of them are doing well. But as time goes by, then we will see how the disease affects different populations. And of course, different case reports are coming out. But I think the general word is that if you have chronic illnesses, that you should be careful.
Okay, let's go back for another question from one of our social media channels. What is used to treat the virus?
So the treatment is, right now, there is no vaccine that is available. And there is no specific antiviral treatment or treatment modality that has been proven over and over to be effective. So a lot of things are still in trials. There have been a variety of medications that persons are testing and have found success, some degree of success, but have not been widely accepted. So as it is right now, it is symptomatic treatment, meaning that we treat based on the symptoms that you are presenting with.
Okay, we are going to another break. I want to remind you as well of the official COVID tip line numbers where you can call to get information. You can email as well. Stay with us. We'll be right back.
Cold or flu-like symptoms. If you become ill, please visit your doctor or the nearest health center and share your travel history. The flu and coronavirus can kill. Let's protect each other. A message from the Ministry of Health and Wellness. Reduce your risk of viral illnesses like the flu and coronavirus. Wash your hands frequently with soap and water. Cover your nose and mouth when coughing with a tissue and dispose of it. Avoid close contact with anyone with a cold or flu-like symptoms. If you become ill, please visit your doctor or the nearest health center and share your travel history. The flu and coronavirus can kill. Let's protect each other. A message from the Ministry of Health and Wellness.
19 tip. Protect yourself and others from getting sick by washing your hands after coughing or sneezing, when caring for the sick, before, during, and after you prepare food, before eating, after toilet use, when hands are visibly dirty, and after handling animals or animal waste. COVID-19 tip. Protect yourself and others from getting sick by washing your hands after coughing or sneezing, when caring for the sick, before, during, and after you prepare food, before eating, after toilet use, when hands are visibly dirty, and after handling animals or animal waste.
Reduce your risk of viral illnesses like the flu and coronavirus. Wash your hands frequently with soap and water. Cover your nose and mouth when coughing with a tissue and dispose of it. Avoid close contact with anyone with a cold or flu-like symptoms. If you become ill, please visit your doctor or the nearest health center and share your travel history. The flu and coronavirus can kill. Let's protect each other. A message from the Ministry of Health and Wellness. Reduce your risk of viral illnesses like the flu and coronavirus. Wash your hands frequently with soap and water. Cover your nose and mouth when coughing with a tissue and dispose of it. Avoid close contact with anyone with a cold or flu-like symptoms. If you become ill, please visit your doctor or the nearest health center and share your travel history. The flu and coronavirus can kill. Let's protect each other. A message from the Ministry of Health and Wellness.
For staying with us for this RGR Gleaner Group virtual town hall meeting on COVID-19. Now, lots of talk about fake news, but Colleen is asking, how do we know we're getting accurate information from the government in relation to COVID-19? And I don't think I can ask the health minister or the CMO that, so let me ask Prof. Figaro.
Oh, okay.
How do we know if they're telling us the truth?
There's no reason. It would be counterproductive to try and mislead the public, because it would become quite evident.
But people might be saying, boy, they're afraid tourism mash up, they're afraid people shun Jamaica, they might be trying to keep things under wraps and pretend things are rosier than they are.
Right. Well, there is a reality that we're a small country with a vulnerable economy. We are vulnerable. So an attempt to manage to have some tourism suits us if we can manage it appropriately. So it is a judgment call, but the decisive actions to promote better hygiene, social distancing, if everyone implements it, then we'll definitely slow the outbreak. I mean, it's going to increase, there's no doubt, but we can manage it more effectively if we have it slowed.
And just for the record, as the only government minister here, there's no reason to, and neither are we hiding any information. In fact, when you look at the history of countries that have taken a more sort of liberal approach as opposed to a conservative approach, and you mentioned it in your opening, you know, it really suits us and suits the country and the government to be very open, very transparent, because again, as I said before, unless you have all hands on deck, the challenge is going to be prolonged, and none of us wants that, and ultimately it will come back at us. So I think it's important, and we've certainly tried to make information available as we get the information.
In relation to, because someone on Twitter was saying they weren't sure they got the right the answer in relation to, for instance, a cruise ship passenger. So, so are you satisfied, doctor, that you've been able to trace each and every one of the patients who are presented?
We're never satisfied that we're done, and that is why we continue. So we are not near finishing. I mean, we have started and we are on the ground, and we're covering as much ground as possible each day. So even with the cruise ship passengers, there are new scenarios that come to light, you know, as recently as 2 days ago, that we've had to explore and investigate. So we have to see where it leads us. I mean, we're nowhere near done.
Marion is asking in relation to information as well. How about handing out literature in communities? People are really handling this badly, as you all mentioned earlier, even threatening to kill people who feel sick from unrelated matters. You know, nowadays, you know, if you want to cough, you feel under threat, can't cough. And as an asthmatic, that's problematic for me. So yeah.
Today I had a meeting, a virtual meeting with Minister Mackenzie and the municipal corporations and the mayor's councillors across the country, where we discussed their own engagement to providing information at the base of the community level. And we're going to be using town criers over the next couple of days, or more of that, because we're doing some of it now, as well as using the vector workers. We have 1,000 vector workers working in the field on the dengue program to distribute flyers to householders. Now we're hoping that we can get a flyer in every house, as well as have a town crier pass every house in every community. Part of just getting the information out there about what is COVID-19, what are the symptoms, who you can call, and how you should behave if you have symptoms. And that we hope will help the situation.
Shamian is asking if government workers and auxiliary staff in particular will be getting any stipends. Did I hear you say, Dr. Thompson? We'll be getting additional stipends during all of this period. Dr. Thompson, you sound like you wanted to.
We did announce some additional, should I say, some additional sums to the regular payments per day for a number of categories of workers, all the way to the drivers. I know there are some concerns about the amount, but the government did offer some additional sums given the challenges or the additional challenges that are going to be faced.
So we had some issues with the amount, but the discussion was had around the fact that this is a national crisis and...
Just for clarity, the stipend we're talking about, the extra payment, is it for extra hours, or is it because you guys are frontline workers at the forefront of the crisis?
Frontline workers.
Okay, so it's like danger pay. What they call it if they send you go Afghanistan?
High risk or hazard pay.
Hardship pay. But I hear it's $3,000. $3,000 per day or per shift?
Per day.
Okay.
So
you look very unhappy, Dr. Thompson.
I can't help it sometimes. But we did have an issue with that, and hopefully the ear is still open for some discussion for us around
I hear
that.
a negotiation going on my stage. Dr. Thompson, you are still open to discussing it?
I'm going to invite him to the Ministry of Finance to have a conversation at that level. Now, if we could, clearly our health workers deserve more. There's no doubt about it. I know they work hard, they go well beyond the call of duty, and there are risks involved, particularly in these circumstances. The issue is just the ability to pay. I personally want to recognize them, use this opportunity to recognize them for the work that they have been doing, because they really have been working very, very hard to really play their part, and I commend them for that. You know, over time we'll see whether or not other forms of recognition can be made. But right now the government has made an offer, and we're going to support them otherwise to do their jobs and do it effectively.
And certainly, you know, us as healthcare workers, we're not going to necessarily use the money per se to you know, drive us to do our jobs, because we've never used it as a driving force behind us doing our jobs. We do our jobs because we love to do what we do. I like definitely doing what I do. And at some point, you leave it to your trade union to have the discussions on your behalf. Needless to say, we'll have the discussions, they're ongoing. And, you know, everybody out there is aware, all the membership is aware that, you know, we are in a national crisis and we are now in work mode, you know.
Okay. The groundsmen, though, I'm getting a message. Groundsmen at St. Anne's Bay Hospital asking why are they not a part of this. They say they have to interface directly with waste material coming from the quarantine facilities.
Oh. Well, I will certainly investigate why. I know we had sought to, when we discussed it, to cover all categories of workers, right through to the drivers and the porters, I believe. I'm not sure why groundsmen are not engaged or involved. Again, I hear about the waste management. I suspect it's because they probably were not seen as being a part of that chain of movement. But I'd be happy to check on to see exactly what has caused that and whether they can be included.
Prof. Then Dr. Thompson.
Well, I was going to say something and connect. So if it's on this, if you...
So I think that's a good point. You know, certainly at some institutions we notice that these same groundsmen are taking all kinds of precautions, which may be a little bit overboard, but really they are in a position that they're really unsure. So maybe the communication channel to them as well needs to be clear and open. You know, certainly they are also an integral part of the team when it comes to clean up, and they handle waste as matter as they rightly say.
Prof?
Yeah, so I think it's good that health providers are being recognized on the front line. They are at greater risk, and it's not the primary motivation that drives health providers. I wanted to just signal another group that we really need to pay attention to, because with the closing of schools, remember that there are many children who depend on school breakfast and school lunch. And so I just want to signal to the government, they're probably doing something already, but also to principals and teachers in communities. Maybe they can organize something locally, but there are vulnerable families out there who depend on that school breakfast and school lunch.
I know the government had announced that PATH beneficiaries will receive packages, and I don't know if it's going to amount to a full breakfast, full lunch. Dr. Tufton?
Yes, the Minister of Education had indicated a series of measures to continue support for the vulnerable, but also, very importantly, also to ensure that there are remote classes that would take place to keep our children or our young people's minds occupied. And I know that is going on. I mean, I have a 15-year-old, so I know he has to do some
we have
work.
to interrogate that whole,
Right.
whole in a whole other program. But I tell you what, let me go to break and we'll come back in just a moment. Do stay with us.
COVID-19 tip. Protect yourself and others from getting sick by washing your hands after coughing or sneezing, when caring for the sick, before, during, and after you prepare food, before eating, after toilet use, when hands are visibly dirty, and after handling animals or animal waste. COVID-19 tip. Protect yourself and others from getting sick by washing your hands after coughing or sneezing, when caring for the sick, before, during, and after you prepare food, before eating, after toilet use, when hands are visibly dirty, and after handling animals or animal waste. COVID-19 tip. Protect yourself and others from getting sick by washing your hands after coughing or sneezing, when caring for the sick, before, during, and after you prepare food, before eating, after toilet use, when hands are visibly dirty, and after handling animals or animal waste. COVID.
Reduce your risk of viral illnesses like the flu and coronavirus. Wash your hands frequently with soap and water. Cover your nose and mouth when coughing with a tissue and dispose of it. Avoid close contact with anyone with a cold or flu-like symptoms. If you become ill, please visit your doctor or the nearest health center and share your travel history. The flu and coronavirus can kill. Let's protect each other. A message from the Ministry of Health and Wellness.
Staying with us, this is our final segment in our RJR Gleaner Group virtual town hall meeting. This is where I try to cram 200 questions into 7 minutes. So let's see what we can do. We just showed on screen the numbers that the public have been told that they can call to get information, report symptoms, whatever. But we've been trying them. Some of them work, some of them don't work. And I know we had been told at one of the press briefings that you were turning them over to a call center. But it still seems very iffy. What's happening with that?
Yeah, so we have placed the calls into a call center setting, and it has worked a lot better than before. There are a number of calls that come in quite frequently, and there's still a limited number within that context unless we expand. What we advise persons to do is to, if you don't get through the first time, try again, because you eventually will get through. We've also provided email addresses so persons can actually send an email and we will follow up. So I think generally speaking they have worked, but there may be times when you have a busy signal because of the numbers of calls coming in.
Okay, we have a question about the residents who are in quarantine in Bull Bay. Are we visiting them one by one? Are we testing them? There are 11,000 of them, so surely testing isn't an option. So.
Okay, so as I mentioned earlier, so we have made almost over 700 interviews with persons within the community. Out of that, we have defined about 200 persons that are actual contacts with the individual, or with persons that may have been symptomatic after being in contact with her. So those persons are being they are being quarantined And in terms of quarantine, then they are followed up every day.
I have taken note of one or two complaints about not getting some basic essentials, food packages, for example. The Ministry of Labour and Social Security is arranging and is in charge of providing those packages. I know today, for example, they distributed some 250, and each day they deliver packages. The corner shops are still open to the extent that people can afford to purchase. The NHF
depends where you live, though, because I mean, I spoke to some residents, and one of them was saying where she lives, there aren't any corner shops, and soldiers told her you can't leave.
Right. So what I've said to the ministry and my team is that we need to beef up the availability of these packages, and so some arrangements are being made to do more. For those who need medication, the NHF mobile unit will go into the area. In fact, they're going to be in the area tomorrow, and they will deal with persons who need that kind of support. So we are offering support on the ground. To the extent that persons have difficulties, they can go to the borders and provide information, and we will follow up.
Question here, let me see, Prof, maybe. I have an underlying illness. I do dialysis at UA. I've noticed the isolation ward is just next door to the renal unit. Is this putting renal patients at risk if they come into contact with the doctors and nurses who are working in the isolation ward?
It shouldn't put them at risk because the doctors know what precautions to take if they're moving from one area to another or from one patient to another. So that should not normally be a risk to them.
Okay, I'm also hearing that the physiotherapists and radiographers also are concerned about COVID and recompensation and whether their role is being acknowledged as well. Dr. Tufton, I think that one is directly for you.
Right. And again, I'll inquire. All of the healthcare professionals are important, obviously. I suspect that the decision around who were singled out was based on their direct engagement with the particular challenge.
I've got this question from about 5 different people, so let me ask, what are the plans for the vulnerable on the streets?
I think that certainly when we get to the point where we have community transmission, we would have to address some of those issues in terms of the homeless persons. I think right now, I guess we're still in that delay to that point of community transmission. It would give us time to make any kind of preparations, but this would have to be a multi-sector approach. This wouldn't just be a Ministry of Health and Wellness, so this is something that we will have to, now that you've brought it up, we will have to take it to the National Emergency Operations Center where all the other state agencies sit so that we can have a discussion as to, you know, what kind of approach can we have to this.
Maybe I should, it's a good point to raise the fact that we have a multi-ministry, multi-agency approach. The Ministry of Local Government, for example, has spoken about infirmaries and what they're doing. Labor, of course, in terms of some of the food supplies, education. So to the extent that we need support for any particular group, you first look at who has jurisdictional responsibilities over that group, and then we channel the discussion and the coordination through that means.
Okay, I'm going to have to leave it there. Unfortunately, I know we have so many of your questions coming in. We couldn't get to them, but I don't know, perhaps we can do this another time in another forum. But for now, this is where I have to wrap up our virtual town hall meeting. Thank you all so much for attending our virtual town hall and sharing with your questions and your comments. We really have appreciated it, of course. Thanks so much to all our guests who came into studio. On behalf of the news and the production teams here, I'm Dion Jackson-Miller.
Reduce your risk of viral illnesses like the flu and coronavirus. Wash your hands frequently with soap and water. Cover your nose and mouth when coughing with a tissue and dispose of it. Avoid close contact with anyone with a cold or flu-like symptoms. If you become ill, please visit your doctor or the nearest health center and share your travel history. The flu and coronavirus can kill. Let's protect each other. A message from the Ministry of Health and Wellness. Reduce your risk of viral illnesses like the flu and coronavirus. Wash your hands frequently with soap and water. Cover your nose and mouth when coughing with a tissue and dispose of it. Avoid close contact with anyone with a cold or flu-like symptoms. If you become ill, please visit your doctor or the nearest health center and share your travel history. The flu and coronavirus can kill. Let's protect each other. A message from the Ministry of Health and Wellness.
19 tip. Protect yourself and others from getting sick by washing your hands after coughing or sneezing, when caring for the sick, before, during, and after you prepare food, before eating, after toilet use, when hands are visibly dirty, and after handling animals or animal waste. COVID-19 tip. Protect yourself and others from getting sick by washing your hands after coughing or sneezing,